Hi, my name's Laura. I'm a nursing student, and today I'm going to demonstrate how to do a physical assessment on a patient while using my general principle and safety practices. And while doing that, I'm going to be assessing their body structure symmetry and their behavior. Now, by assessing their behavior, I'm going to be assessing their grooming, their hygiene. I'm going to see if they're holding an eye contact or not. I'm also going to be checking to see if they are short of breath. I am going to be seeing if they're in any kind of distress, or if they're anxious or depressed or anything of that nature. So first we're going to perform hand hygiene, and we're going to go see our patient. So we are going to get our hand sanitizer, put on our gloves, and let's go meet our patient. Knock, knock, knock. Enter the room. Hi, my name's Laura, and how are you doing today?
I'm good.
Great. Can you tell me your name and date of birth?
Riley, 9/2/2004.
Okay. Now we're going to use our two patient identifier with her bracelet, and yes, that checks out. And do you have any allergies?
Not that I know of.
Okay. She says no. So now at this point, we're going to perform a mini interview, and I am going to check and see if she has had any past surgeries, her medical history. I am going to check and see about her immunizations. I'm going to just ask her if she has any recent immunizations and see if her immunizations are up to date. I've already checked about her allergies. I've already asked her. I'm going to ask her about her medication. I'm going to ask her if she takes any medication from a prescriber, if she takes any over-the-counter medications, if she takes any supplements, any herbal supplements over the counter, or maybe any supplements that she just goes out and gets from the wild and makes any kinds of teas or pulses or tinctures of that nature, because there can be some kind of counteractions and indications from that point with her medications as well that she could be experiencing. So at that point, the patient might have a list that would be very convenient that she could give me. So I would also be asking the patient a few more questions about where does the patient live, and what about the patient's educational status? How far in school did the patient go? I could be also asking the patient about their financial stability. Does the patient have current health insurance? Does the patient have a support system at home? What about the patient's social practices? Do they have a social life? Do they just sit at home? I mean, does it cause any kind of problem in their life? At this point, I would also ask the patient if they are feeling anxious or depressed today. Are you feeling anxious or depressed?
Yes. Both of them.
Okay. Are you feeling like you could harm yourself or others?
No.
Okay. So do you feel like you are stable with your anxiety and your depression and stuff? Okay. So today I'll be performing a head to toe assessment. And is it okay if I put hands on?
Yes.
Okay. Now first what we're going to do is we are going to take your vital signs. Now with your anxiety and depression, is there anything you do that makes you feel better?
YouTube.
Okay, so YouTube makes you feel better? Okay, do you have a specific doctor that you go see for your anxiety and depression?
My primary care doctor.
Okay, are you in counseling, or so you don't have counselor that you go see? Okay, so does your primary give you a medication for that? Because I'm looking at your list right now and I do see an antidepressant. Okay. And it looks like you're on Lexapro and Buspar.
Yes.
Okay, and you take those things, are those the only things that you take
Yes.
medicinally? Okay. All right. Let me. Okay, do you want to talk to the doctor today about these two things?
Okay.
Okay. All right, so I'm going to take her blood pressure manually. Okay, squeeze, squeeze, squeeze. Okay. Blood pressure, O2, temperature. And I'm going to check for a manual pulse on both radial pulses. And I'm also going to check her respiratory rate. And I'm also going to ask the patient if she is in any pain today. Are you in any pain? No? Okay, that's good. Now that we got the vitals out of the way, now I'm going to start by doing the hands-on portion of the physical exam, going from head to toe. Now, what I'm going to be checking for with your head, I'm going to be checking for any kind of bumps, lumps, abrasions, anything that might be abnormal. Okay? Okay, I don't feel anything abnormal. I'm going to go down and check your ears, check for any lumps, bumps, abrasions, anything that's not supposed to be there. Now what I'm going to do now is I'm going to shine a light in your ears. And what I'm doing is I'm checking for any kind of swelling or redness.
Is there anything in there, Doc?
No. I see an adequate amount of earwax. The medical term for that is Serica. And I don't see any hearing aids. So you're looking good there. Now I'm going to shine this light up in your nose. You might want to close your eyes. It's awfully bright. And again, I am checking for redness. I'm checking for swelling. I'm checking for drainage. Any kind of foreign bodies that might be up there. Have you been having a snotty nose? Any drainage?
A little bit.
Okay.
It comes and it goes.
All right. Now, I'm going to shine the light also in your mouth because I am checking for your moisture in your mouth, making sure everything's pink, making sure you don't have any sores, or that's what I'm looking for. Okay, so say ah, great big ah, and making sure I don't see anything abnormal in your mouth, anything that should not be there. Now, is that your regular teeth?
Mm-hmm.
Okay, so you don't wear partial or dentures or anything? Okay, great. Now I'm just gonna feel a little bit, touching one at a time, checking for lumps and bumps. Do you have difficulty swallowing?
Mm-hmm.
Okay, can you say a full sentence for me?
Hello, my name is Riley.
Okay, great. What I was doing is I was checking to see if your speech was slurred or anything. Okay, now I'm going to check the skin on your chest, and at the same time I'm going to check your skin turgor. Okay, and your skin turgor is what you check, is what you do to check for hydration. So just a sweet little pinch right there, and it looks like you are well hydrated based off that test. I'm going to look at your chest and checking for bruises, lumps, bumps, lesions, any kind of insect bites, you know, anything abnormal that shouldn't be there, okay, to include edema. And if you can sit forward for me, I'm going to do the same for your back, checking for things that are abnormal, bruises, lumps, bumps, edema, anything that shouldn't be there. Now I'm also checking down in your sacral area, you know, right above at your tailbone, for any kind of lumps, bumps, abrasions, any kind of skin breakdown where the skin is not intact, okay? But you look really good. You have nothing abnormal in that area. Now what I'm gonna do is I'm gonna go down to your arms.
And I do have a cat.
Okay, that's good to know. Yep, I already see some little sweet scratches. Now, again, we're talking about those lumps, bumps, and abrasions. Going down your arm. Okay, checking your pulse again. Checking your hands. Seeing if there's anything abnormal. Well, you got cold hands. Checking your hands. Checking your capillary refill. And I'm going to do the same on this side. Checking for lumps, bumps, abrasions. Checking that capillary refill. Okay, so you are equal bilaterally on your arms. Now what I want you to do, hold out your arms. Okay, okay. Now I want you to turn them around, go like that, to the side. Okay, you got great mobility, or great range of motion. Now I'm going to check your legs. Now what I want you to do is kind of hold it out for me, because I am checking your legs for any kind of lumps, bumps, abrasions yet again, and I'm also checking for that edema. Like I did up in your arms, I was also checking for edema in your arms. I'm checking for that edema in your legs. Any kind going down your legs, and I'm also checking for edema in your feet. And I'm checking those pedal pulses in your feet as well. Now, I'm checking the bottoms of your feet and checking for that skin being intact in your heels, okay, because that's a sweet spot right there. Checking for any kind of redness, skin breakdown, going up your feet, checking your toes, any kind of skin breakdown in your toes, and I'm doing the same over here to the other side, checking for lumps, bumps, abrasions, all the way down into your feet, checking for that pedal pulse, checking for capillary refill on both toes, and again, also over here, I'm checking for that skin breakdown, especially over here in the heel, on the whole foot, checking for edema. And okay, what I want you to do now is stand up, because I'm going to check your gait. So if you could walk that way for me. Okay, great. Now come back. Okay, wonderful. I see nothing abnormal. Go ahead and have a seat for me. Okay, well, is there anything else that you want to tell me that might be abnormal?
Mm-mm.
Okay, great. Well, I've enjoyed this time. Thank you for allowing me to perform this physical assessment on you. And can I get you anything before I leave?
No, thank you.
Okay, great. Well, this concludes the physical assessment for today. And what I'm going to do is anything that I have assessed with this patient that's abnormal, I'm going to report that to my RN, but I am certainly going to document at this time. And I am going to take off my gloves, perform hand hygiene, and go document that at this time. Thank you.